Some people just are obsessed with food, but there are other people out there that try very hard to lose fat and lose weight and nothing works. Some of
Hmm.
it's hormonal and some of it's, of course, as a person gets older, things like that can happen. And so when we learned that there was an element of light that could not possibly hurt anybody, you're not freezing the fat, you're not boiling the fat, you're not using ultrasonic cavitation or radio frequency or any of those things that are called non-invasive, but they're really about destroying essential tissue. Well, as a chiropractor, I'm not interested in destroying tissue. Imagine now we can help in a method that will actually assist, that has absolutely no side effects.
If you've tried everything for pain, illness, or weight loss and nothing seems to work, this episode could change everything. Dr. Carl Rothschild reveals why red light therapy is becoming a game changer in modern healing. This is the Green Living Now podcast, where I bring you no fluff conversation with change makers and wellness pioneers who cut through the noise and share what really works for clean, non-toxic, eco-friendly living. I'm Amy Tedisco-Hartshorn, upcoming TEDx speaker, organic farmer, and green living mentor for over 30 years. I am here to help you connect the dots between what you eat, what you're exposed to in your home, and how you live and feel. Welcome, Dr. Carl Rothschild, to the Green Living Now podcast.
Thank you so much for having me. I love
Ah.
talking to and introducing people to new and what I think wonderful stuff.
Yes, I'm excited to hear about this because I know just a little bit, but I know you've got a lot of great information that you're going to share with us. So the standard question is, how did you get into this?
Well, it was 1972, and I was a junior at Stony Brook University, which is a pretty good school out there in New York.
Hmm.
But I was trying to decide what did I wanted to do. And more than once, chiropractic came up by chance. I mean, it just was an interesting thing. Now in New York, it was frowned upon quite severely, but
Oh, God.
being as rebellious as I was and interesting as I was in learning something that might be wonderful. I'm the kind of person that actually takes pleasure in helping others. Not everybody's like that. I'm not bragging. I'm just saying that's
No, I can relate. I totally can relate. That's why I
I
do the
like
work
that.
that I do. Yeah.
So I'm more interested in helping than making money. I don't mind making money. So when 1972, when I started doing research on it, I explored this pretty well. And I spoke to a lot of chiropractors, and every one of them loved what they were doing. And I wanted that, helping people, making some money, and loving what you're doing. In a career,
That's
what else
awesome.
would you be looking for? And so I became a chiropractor in 1978, loving it. And I'm a bit more of an entrepreneur than I thought. So I had 12 practices overall, not at the same time, but yeah, I was a little nutty. I had four of them in gyms, four chiropractic offices in gyms. So I
Huh.
know that role really well. But then 20 years into my practice, which by then, being a wise guy from New York, I figured I knew everything. I was introduced to light therapy. And it was by the first guy that really got FDA clearance. He's a medical doctor, an orthopedic surgeon, and a professor out of USC out here in California. But here's this Chadwick Smith, and he hands me a flashlight that looks like a flashlight. And he said, come and help me save the world.
Wow.
And I thought he
Okay.
was nuts. I mean, completely out of his mind. What are you talking about? I'm going to save the world. But turns out that, I was using this flashlight in my practice just to probably prove him wrong. I mean, I didn't believe it. But within a month, we saw that we could make some really nice changes with it. So I started healing things that I never believed I could.
Can
This
you give
lady
me
had,
an example?
yeah,
I'm
this
really
lady
curious.
had gum disease. So I'd go to all my patients and say, look, I've been treating you for a long time with all these traditional chiropractic stuff. And my question to them was always, well, what else do you got?
Hmm.
What else do you got? And invariably, they came up with all kinds. This lady had gum disease. I helped her. This guy had kidney problems. I helped him. Just myriad
So,
of
but
different
went well
conditions.
beyond what your chiropractic training
Oh,
was
yeah.
teaching you could do to help
Well,
people.
no, I mean, my training was a primary care physician or doctor. So
Oh,
I
okay.
was aware of a lot of different conditions, but it was outside of my scope. I'm not a dentist, and
Right,
my goal
exactly.
was not to be a dentist, but she had gum disease, and we said, we know one thing. We knew back then one thing, it couldn't hurt. That we knew for sure. No
Yeah.
matter what, we couldn't hurt somebody. So why not try it? And it was just one thing after another with really fun success, mostly musculoskeletal issues, TMJ, carpal tunnel. In
Hmm.
fact, carpal tunnel was the first thing that got the FDA clearance. That was what the study was. And carpal tunnel sounds simple, but it's more complicated than you'd think. And it's a
Hmm.
neurological entrapment, which means you got nerves involved. Anytime a nerve is involved, it's way more complicated. Brain and nerves, way more complicated. And it passed, the FDA clearance was through the carpal tunnel. But at any rate, so it was mostly, primarily musculoskeletal issues that chiropractors were using it a lot.
Well, so let me just interrupt for a second. So the big game-changing feature was the red light therapy. That was what healed the gum disease as opposed to a combination of chiropractic and red light, or how would you explain that?
With the gum disease,
Yeah,
it was entirely the light.
entirely the light. Okay.
So there I am using light therapy, having nice success. And that was a class 1 device. We developed class 2, 3, and finally class 4 devices, which was, we were having constantly beautiful success, again, with no possible side effects. In fact, in the 50 years that this technology has been studied, there's never been a recorded side effect. And that's
Really?
important for people to know. You couldn't hurt somebody with this if you tried. And that's why anybody can, perform this. You can have it at home and all kinds of stuff without any fear of getting hurt.
Even if you were to use it like hours on end, you can't overdo it.
Yeah, you're just wasting time. I mean,
Right,
if
right.
a dose is this and you do that,
Yeah,
a dose is a dose. You're just wasting time. And if
right.
you practice, you're wasting money.
Yeah.
So, no, you couldn't hurt somebody. So
Didn't
there
hurt.
I am, let's say 15 years ago. They had done research and found out that a certain element of light that I was not using could actually help with fat loss. And that took the whole technology to a whole nother level because if you don't know that, and I'm sure you do, there's almost nothing more popular in this country than weight loss. People are willing
Oh
to
my
do all
gosh.
kinds of crazy things, kill things, destroy things, take pills and injections or
Oh
whatever,
yeah.
knowing what the side effects are, as long as they can lose fat. Well, imagine now you can lose fat using red light therapy with no possibility of harm, and it works. There's no side effects, there's no contraindications with it. It works. And I'm going to go over the mechanism in a little while. So
Okay. So I'm
we
just
talk about how it
curious,
works.
just thinking about the fat loss since that's so popular. Can you give an example of somebody, patient X comes in with X number of extra pounds and it takes how many treatments to get them? And are they doing other things too besides the red light
I
therapy?
mean, you can't go home and pig out and get drunk
Right.
every
So you have
night,
to change your
but
diet to some extent.
there's not a lot of people that know as much about diet and weight loss as I do. When I was a young preteen, my mother became an executive of Weight Watchers, which sounds like
Oh.
fun, but I never had a good thing to eat again from that point on at home.
Ugh.
But it worked. And I learned a lot and I used that. And beyond that, I got involved with learning how to teach for my patients. A patient loses 40 pounds. My job becomes much easier, as a chiropractor. So weight loss was a great thing, but not so easy. So, some people just are obsessed with food, but there are other people out there that try very hard to lose fat and lose weight and nothing works. And some of
Mhm.
it's hormonal and some of it's, of course, as a person gets older, that happens. Things like that can happen. And so when we learned that there was an element of light that could not possibly hurt anybody, you're not freezing the fat, you're not boiling the fat, you're not using ultrasonic cavitation or radio frequency or any of those things that are called non-invasive, but they're really about destroying essential tissue. Don't let anyone fool you. It's about killing cells. As a chiropractor, I'm not interested in destroying tissue. Imagine now we can help in a method that will actually assist, that has absolutely no side effects. And yes, of course, it's important that you not starve yourself, but that you help. And the help
Yes.
would be what we call a smart diet. A smart diet essentially is calorically neutral.
Okay,
And
wait. What does that mean? Calorically neutral.
so a person who's a certain weight needs a certain amount of calories a day
Yep.
to maintain their weight. So like with an average male of 5'8", let's say 10, whatever, you can look it up. What is the calorie intake that you should have, that's called calorically neutral. You're not eating more than you should, you're not eating less than you should.
Okay, so it's calorically neutral to the desired weight as opposed to their being overweight. Is that right?
Yeah, you wouldn't want to have the calorically neutral for a 400 pounder.
Exactly.
It's 400,
That's what I was
it's
thinking.
calorically neutral for them, but it's
Yes.
still very doable. Like there are a lot of diets out there that are 500 calories a day. That's tough.
Yeah, I did
And,
that.
and it works. Anything works.
Sure.
But it's not so important to get somebody to lose the fat. What's more important is to keep it off. And most people don't. 95 or more percent of the people that have been on a diet put all their weight back on within a year,
Oof.
and often more than that. So diet in general out there, they don't work long
Yeah.
standing. Now, if you just needed to lose the fat to get into the wedding dress that you bought months earlier, I can understand that. But if you really want to maintain and sustain, it's the same thing with everything. I try to teach people to do this long term, exercise long term,
Hmm.
eating right long term. And of course, there are bumps in the road. You might not exercise all the time. You know, it's 3 times a week. You might
Hmm.
not eat perfectly 7 days a week, but you try to do
Right.
it as well and as much as you can.
So what I'm hearing you say is basically it's a healthy lifestyle, eating, you called it, well, and also I think, do you talk about the types of things that people are eating? Is that part of what
So
you?
you want to eliminate, yeah, we're not going to go over that in detail today,
Right.
but you want to eliminate starchy carbohydrates, simple
Right.
sugars, sodas, and alcohol. I
Right.
mean, there's a lot of things you should eliminate, but those are the 4 things for weight loss.
Okay.
Starchy carbohydrates. When they first
Pasta,
learned,
potatoes.
this was years ago, that a bowl of pasta might be considered also a bowl of sugar. And you never eat a bowl of sugar, but you're eating a bowl of pasta, which is absorbed by the body like it's sugar because it gets converted to glucose so quickly and it
Mm.
screws up your pancreas, it screws up your weight, and those are problematic. So, then you hear people say, well, it should be a high protein diet. No, it should be a balanced diet. And a
Mm.
balanced diet is basically equal fat, protein, and carbohydrate.
Yeah.
When you have a calorically neutral diet, staying away from the things I mentioned to you, we see
Yes.
very nice success. And it really, again, it's not just about losing the weight, but more importantly and more difficult is to keep it off.
Hmm.
And that's a whole challenge unto itself.
So I'd love to understand the mechanism behind the red light therapy. How
I'm
how
going
does
to
it
make
work?
you suffer here. You are going to suffer for a little while, and I'm going to save the mechanisms both for the fat loss and for the healing for just a moment. But I want to
Okay.
go through some stuff as we're moving along. So there we are 14 years ago, learning that there's a certain element of light that could actually help with fat loss. And that's when I said, you know what, I'm going to take this to a whole nother level. And I started manufacturing my own equipment. I
Hmm.
wanted the best. I knew what we needed. I also wrote the book that I welcome people to get, which is called Illuminated Healing. And I'll send you the show notes. It's on Amazon, and I don't make a dime off of it. I'm just telling you, if you want to learn about red light therapy, that's one good way.
Hmm.
So moving right along, there I am 14 years ago, getting involved with manufacturing. And mostly we were manufacturing pads, panels. We were involved with lasers, all about the state-of-the-art equipment at the time. But then something happened to all of us called COVID. And our practitioners, and we had hundreds at that time, wanted the less physical contact between the patient and the provider. And we came
Aha.
up with this bed. Now, this bed here, if you can see it, is fifth generation. So the first bed we came out with years ago was just a substitute for what we had made up to that point. We figured, okay, instead of lasers, instead of pads, let's try the bed. And so we started shipping out years ago the first series of beds, and wow, you cannot
And so
believe,
was this to individuals or was this to other practitioners? Was
mostly
started
practitioners.
practitioners.
Mostly this is what I manufacture are medical grade devices
Mm.
that are not the simple stuff that you get off of Amazon.
Right.
This is high-end stuff that it doesn't work subtly, it works intensely.
Mm.
And when I say intensely, it doesn't hurt, you don't feel anything much, but the results are not subtle.
Hmm.
Well, let me give you an example. We send out our first series of beds and just expecting nice reviews about how it was at least as good of the equipment that we had been producing up to that point. And then we get things like Arnett. Now, Arnett calls and he tells the practitioner, listen, I'm having heart attacks once, if not twice a week.
Oh, my
And this has
word.
been going on for 12, 13 years. I had never heard of
He's
that.
still alive?
Let me tell you. So there he is telling us, this was a while ago, about the fact that he was having these regular heart attacks. It started out once a month, and twice a month, and 4 times a month. And eventually, by the time we met him years in, it was getting to the point where he was, like you say, he's still alive. He was dying. I mean, his energy was gone, his clarity was gone. He had severe erectile dysfunction. Everything you can think of that could go wrong went wrong because he's killing off his body by having no blood flow. His circulation's done. He used to be an athlete, and now can imagine how depressed he is because taking 10 steps was difficult.
Uh,
So I told the practitioner, I said, because practitioner didn't want to treat him because he was having heart attacks. He didn't want to have him have one in his office. I said, why don't we just treat him for a few minutes? And normally a dose is 12 minutes. Let's just treat him for 5 minutes and see what happens.
mm,
And the patient goes home that night. That was basically 2 years ago.
hmm.
Has never had a heart attack since. He's had more treatment,
Wow.
no more heart attacks.
So,
Everything has come back to life.
well,
Everything.
that's incredible.
Pressure's normal. His pulse is normal. Everything has come back to life. And that's when we knew, okay, this is not just a substitute for what we were making up to that point. This goes way beyond that. And
Mm,
what we learned is that when you bathe the whole body at the same time,
hmm.
that's when you get the miracles.
That's the bed. Oh, wow. That's
That's the
incredible.
contrast between the bed and the other equipment that we still make, which is pads, masks. And I have no objection to helmet, mask, all these things,
Mm,
but I've gotten so addicted to these miracles where people are
mm.
contacting me and telling me, look, I had Lyme disease. I'm not me. This guy's saying he had Lyme disease when he contracted it when he was 12.
Oh,
And it ruined his life. And it wasn't until he was in his 50s when he gets into one of our beds. He had no energy. He could not have a career because there were days where he couldn't make it to work. I mean, he just
mm,
ruined his social life. It ruined everything for him. And I'm not going to tell you everything that happened, but I'm going to send you these videos. And one of them's Arnett's, and one of them's Steve's. And I welcome you and your audience to watch them and to know why. Remember, I started as a hippie in 1972, wanting to help,
right.
and why, when I was talking to Steve and Arnett, why you would see goosebumps, that I had goosebumps from these conversations, and I would stay quiet as much as I could because they were just telling me these unbelievable results that they were getting. And we have many of those, and I'm going to send you all these videos, both of the patient videos and the practitioner videos. And the practitioner videos is interesting because remember, yes, there are people that buy this bed. Remember, it's a high-end medical
Right.
grade bed, and so it's not, the hundred
Not cheap.
dollar junk that they have on Amazon. So we're talking about high-end, expensive, relatively expensive. And why would somebody get it for home when they realize I'm 73 years old? I get in that bed 3 times a week, not because I'm ailing in any way, but I don't want to. I always taught my patients to try to age more gracefully.
Mm,
I can't stop you from getting older, but wouldn't it be nice that you're like a candle that burns really bright from the beginning down to the bottom and then sputters out and dies?
ooh, I like that analogy.
That's the ideal
Yes.
scenario. Most people, that's not what happens. The last 20 years of their life, often they're invalids. I
Yeah.
shouldn't say often, more often than it should be.
Right.
And they're winding up. And if you want to learn and get freaked out like I did, when I'd have patients coming to my office, and I wouldn't say it out loud, but I would think to myself, God, please don't let me wind up like that. Because I don't want to spend the last 20 years of my life as an invalid. I don't want to spend the last 20 years of my life where I can't feed myself, I can't bathe myself, and I can't even wipe myself. Not interested.
Right.
And
No,
not being
me too.
mobile, not being able to drive, and all that stuff, and not having the clarity of mind that you'd also want. Anyhow,
Hmm.
so you can imagine these beds became unbelievable. And when you want to see the bumps in the popularity of this technology, you can see first as we moved along, it was some interest as we went from class 1 to class 4 devices. There was
Hmm.
some bump there. Then a huge bump when we found out that there was a certain element of red light that helped with fat loss. And then even a huger, larger bump when we went to beds, because now we're not just playing, we're serious here. We're not just doing parts of the body.
So inevitably people watching are going to want to have an experience of this. Are they in every state in
Pretty
chiropractic
much.
offices?
So what they're going to do is they're going to go to the website, and I think you can see it right here on the backdrop.com.
Trifecta Light. What is it? Oh, trifectalight.com. Okay.
And the trifecta is the triple effect. That's what it stands for. Triple effect of face, fat, and healing. So before we had the full body, and we called Trifecta one of our devices in the past, it was for face, fat, and healing. But it turns out it's for all the skin, fat loss, and for healing from head to toe.
So it does all of that stuff. And is it something that you program in to like a,
Yeah. Yeah. Each
hard to
person,
say.
it's customized for the
Customized,
individual,
that's what I'm looking for.
based on the person's individual issues as well as their size.
Okay.
I'm skipping around here a little bit. We just want to mention that heat is the absolute enemy. When you
Heat.
have medical grade heat, H-E-A-T,
Okay.
heat is the enemy. So when you have a medical grade high-end device like ours, our goal is always to have a lot of strength, but no heat. So when you're talking about, for example, a red light sauna, that's exactly what you would not want.
That would be the opposite of what you
Right.
recommend.
Now, red light saunas are fine for what they're worth.
For the type of healing we're talking about here.
Correct. And
Gotcha.
here's why. Heat dilates blood vessels, brings more fluid to the surface of the body, and would absolutely block the penetration of the light. So when I take a heat pack off a patient's back, it's bright red, right? Well, that's not what we want. We don't want heat. We don't want fluid coming to the surface and then blocking the penetration of our light. So you want high end. And so when we first developed these 20 something years ago, we called it cold laser, cold light, cold whatever, low level laser. They were all about being under the radar and not even letting the body react to what we were doing so we can get the deepest penetration possible.
Is there like a cold setting that keeps the person cooler inside this
Not
bed?
literally cold. It's just, they called it cold laser just to distinguish it from hot lasers. But it didn't get hot. It didn't get cold. It stayed
Okay.
neutral, but they called it cold laser.
Okay.
So I think that sounded cooler than neutral laser.
Sure. Yeah, I guess so.
So let me just continue for another second
Sure.
here. So there we are developing these beds and sending them out and people having these remarkable results. We talked about how heat is the enemy, but you asked me, or do we have them all over the country? So you go to the website, trifectalight.com, and you go to the Contact Us page. When you go to the Contact Us page, on the left side is requesting information from you so we can find a location closest to you. And we do that many times every day. I have staff just dedicated to that, to get people to the closest location. I'm telling each one of you, I want you to listen to this. And this is a little nervy of me because I'm from New York. You're no longer allowed to complain. You can't complain. I don't care. I don't care what your ailment is, but until you've used the bed 6 times, that's 3 times a week for 2 weeks. Remember, a dose is only 12 minutes. Try it 6 times.
Okay.
And if you don't see a difference after 6 visits, one of 2 things happen. They neglected to plug the bed in the first place, which is a joke. Or the second thing is you have waited so long and your ailment is so far gone that maybe it's irreversible. Maybe you need more than 6, but that's pretty rare.
Well, how much did that guy with the heart attacks need?
1 visit.
That was it? One visit did it for him?
No, he had more treatment. I'm not saying 6 visits to be cured. I'm not even supposed
See
to.
something
You
change.
see a change.
I see.
Well, you could talk to somebody who has severe Parkinson's, for example, and they're rigid as a board. In this case, what I'm going to be talking to you is somebody who's kind of out of it, right?
Like
The
brain
dementia,
fog,
so,
kind of early
no,
dementia.
dementia. So
Dementia. Oh,
they're a danger to themselves and to others. And so the family was getting ready to put her in a home.
oh boy.
But they tried this red light bed as a last resort. Now, getting her in the bed was very difficult because she's so rigid, like a stone. So they helped her into the bed. Getting out of the bed was much easier. And ever since, everything has improved over the weeks that she was treated, to the point where there's no way they need to put her in a home. She's now lucid.
Oh my gosh,
She can
that's
communicate.
incredible.
She couldn't communicate before. It's about everything I always wanted, right?
Yeah, my mind is spinning with all these different thoughts and questions. So can it help with somebody that has severe
Arthritis.
osteoporosis?
So hold that thought, okay, for a second, because
Yeah.
when you ask these questions, you have to understand, as we're all smart enough to know, that no
Yeah.
one thing is for everything, right? So
Right.
if somebody has an arrow in their shoulder and we put them in the bed, yeah, they'll feel better, but it would be smarter to get the arrow out of there. So
Yeah, exactly.
we pull the arrow out. With osteoporosis, there's more things involved, and especially as woman gets older, especially hormonal issues will happen. It's more often with women,
Yeah.
and it's more often with thyroid and calcium metabolic imbalance and things like that. So when you combine red light therapy with, now I'm a big fan of whole body vibration. So in fact, when anyone gets one of our beds, it comes with whole body vibration. So they
Oh,
get off the bed and then we put them on a whole body vibrational unit. That will stimulate the circulation in such a way, both lymphatic and blood, that it helps with osteoporosis. I had one patient in particular that just coughing could crack a rib. That's how osteoporotic she was.
yeah.
And using the light and in particular also the whole body vibration, she not only got much better, but there was many other ailments and issues that people don't realize they have until it's gone. Someone will get in our bed and they'll go, I didn't even realize how constipated I was, and now I'm doing so much better. Or I sleeping like a baby, and I thought I was sleeping well, and now that much better. So you see that when someone gets better from things that they didn't even realize was an issue for them.
Wow. I got to try this.
Everybody does. So remember,
Yeah.
if anyone has an ailment, you can't complain anymore until you've
I
used it
gotcha.
6 times.
Okay.
Then after that, if you go 6 times and don't see any change at all, then I want you to send me an email. It's so rare. And
Huh.
it can't happen, but it's pretty rare. Like someone loses a finger, we're not growing the finger back.
Right.
You understand? But
Yeah.
almost every condition I'm hearing about, we're seeing phenomenal results. I don't care, we're talking about men's health, women's health. We're talking about athletes. So if an athlete gets in our bed before their activity, they're going to perform better, run faster, have more stamina. I had a guy call me not that long ago telling me that he can now swim twice the distance he used to be able to swim, strictly because of the red light therapy bed that he got in. So I'm not making medical claims, I'm reporting the news.
Okay.
So I'll tell you how you can look this up so
Okay.
you know that I am reporting the news.
Okay. Good.
But all I'm telling you is that after 6 visits, if you don't see a change, I want you to contact me. Of
Gotcha.
course, that's pretty rare. Now, we're not talking about curing, we're talking about treating.
Mm-hmm.
Because unless I'm a drug company, I can't talk about curing, but I can
Yes,
talk about
exactly.
treating. Imagine every athlete would get in the bed before their activity and perform much better, and get in the bed after their activity and recover so much
Mm.
quicker. And even the mental health industry, and I'm about to tell you how you can look this up for yourself. And
Okay.
don't believe me. I don't care if you believe me.
Right.
I'm
Right.
going to show you how you can do this.
Okay.
One of our practitioners had a patient that was so depressed. She hadn't seen joy in her life in so many years that she was wondering if life was worth continuing.
Mm.
And after 2 weeks of being on the bed, she wrote me an email, and it's continued. She's still doing great. She wrote me, if this is how normal people feel every day, I can't believe I've been missing out all this time. So even the emotional and psychological world has seen great success. Now, do psychologists get behind this? No. They feel
Puts
it.
them out of business.
No, it wouldn't put them out of business if they had a bed in their practice.
Oh, that's true. That's true.
If you're the psychologist that's getting people better, who cares the process?
Yes.
They're coming to your office to get better. What
Exactly.
more do you want?
Well, I want to talk to my local acupuncturist friend and see if he'd be interested in getting one because, boy, my husband and I would love to experience this. My
I,
husband's an organic farmer and he's farmed all of his life, and it takes its toll.
well, we're so close to learning how it works in just a moment.
Yes.
But I just wanted to make sure I covered all the bases here. So we talked about the
Gotcha.
book, we talked about the website. I do recommend people get to the YouTube channel.
Listen
You're
to show
going to see
notes. Yep.
130 or more of really great videos. Why does it work? How does it work? Blah, blah, blah. What you should be looking for in your own equipment. The reason why people sometimes don't take care of themselves is because they're not scared enough. Now, I already told
Mm.
you that as a chiropractor, I got scared. I didn't want
Hmm.
to wind up like, as I said, some other people. But if you're not taking care of yourself at 30, 40, 50 years old, You're not thinking about what your life's going to be like when you're 20, 30, 40 years later.
Correct.
I don't want to be an invalid. And if you want to be an invalid, fine. You don't want to be an invalid. People are just not thinking straight. They
Right.
don't understand because in this world, health doesn't pay. No one makes money off of
Right.
you being healthy.
Right. Exactly.
They make money from you being sick.
And being a repeat customer.
And exactly. I've been doing this 50 years as a student and as a chiropractor, and I have studied it, I've evaluated it. It's not about a conspiracy, it's about reality.
Yeah.
Reality is money talks, and that's the only thing that people listen to. And if I go to a doctor and say, here, you can make $30,000 doing this or not, what do you think they're going to do? These are not evil people. You're giving them
Right.
an unfair situation.
And their training is very limited as far as true health and healing, in my opinion.
Well, because that's not the emphasis. Drugs and
Exactly.
surgeries is the
Exactly.
essence.
That's what makes the money. Yeah.
By the way, before I move on to how this darn thing works,
Yes.
I just wanted to mention to you what kind of money we're talking about. So how people don't realize how expensive it is to be sick.
Right.
Not just the sickness that they're going to have, real cost to the doctor, real cost to the hospital, but how about the fact that your life's ruined? There's a incredible video going on around now of that you don't have anything if you don't have your health.
Agreed.
And I'm having one of my staff members redo it. It's a beautiful video about how you go along with your life and everything's great until it's not. So if you'd like to postpone illness, if you'd like to get well, then the smart thing is taking care of yourself.
Absolutely.
So one of the elements, it's not the only element, but obviously eating smart, with not drinking, not smoking, and exercising 3 times a week, just 30 minutes of cardiovascular. Now, when I teach my patients to exercise and they go, you know what, you're right. I'm going to do 3 hours every day. No, they're not. They'll do it for a week and then they go, I can't do 3, and they quit.
Yeah.
So you want to do something that you can incorporate in your life. It's the same thing with eating. We're not asking you to never have something that
About
are
sustainable habits.
correct. So you're ready to learn why and how?
Yes. Yes. I can't wait to hear that.
So there are 2 completely separate mechanisms. One is about fat loss, and one of them is about everything else. That's the healing, that's the hair restoration.
No kidding. Hair restoration too.
Absolutely. Well, hair restoration when it's about illness, not hair restoration.
Oh, okay. Not just like male pattern baldness or anything.
We're not going to change genetics,
Okay. Gotcha.
but we can change problems. So it's the difference between a freckle, which is not a problem. Body doesn't look at it as a problem.
Yeah.
Versus some skin ailment.
What about like alopecia?
That's an interesting thing. It depends on what caused it.
Oh, okay.
So yes, I've had people contact me and say they have hair now where they didn't have before. But alopecia is a very interesting thing. Half the time, more than half the time, they don't know what caused it.
Exactly.
So if we know the cause and it had to do with some disease or something like that, typically that could be reversed. But you're no longer going to ask me difficult questions, all right? Alopecia, of all the things, think of anything in the whole body and you're bringing up alopecia.
Well, only because I knew somebody that had alopecia.
I
We were
do
talking about
too,
hair,
and
so immediately I went there.
it's not as success with alopecia as we do with other things. So
Gotcha.
let me
Okay,
give you
so
an example.
let's go to the mechanism
We're
part.
working our way down the body. Now let's go to the eyes for a second.
Oh, okay.
So when someone gets in our bed, they don't wear the goggles because the goggles would block the penetration of the light. Just keep your eyes closed.
Yes.
So you might say, well, what happens if I open my eyes? Nothing. It's just a very bright light that can be annoying. So keep your eyes closed. Could it damage your eyes? No. If you took a flashlight and stared at it just like that, it's annoying, right? And eventually you just want to close your eyes. Well, these lights are really bright. But if you wear the goggles, you're not going to get the beautiful, glorious things that can happen. So think of anything that can go on with your eyes.
Glaucoma.
Degeneration, macular edema, glaucoma, uveitis, floaters. Even eye vision can be improved, but that's a whole nother story.
Huh.
We have seen results with all those things. So if you have an eye issue and you haven't tried 6 visits, then you can't complain. And if you have a mouth issue, so people get in on our bed, they close their eyes, they open their mouth
Oh,
because we want to get in there. Gum, throat, tonsils. When I say gum, I'm talking about gum disease.
what about tooth decay?
Okay. No. Okay. You're getting minus points here as we
I'm
go.
sorry. I'm
So
getting big X
tooth
marks.
decay and decay in general, that's much more difficult because that's not the body's ability to stop. Some things would be better if it never started in the first place.
Right.
So what you want to do is prevent those things. But if you have tooth decay,
You
run
can't
to your
reverse it.
dentist right away.
Yeah.
But if you
Okay.
want to make sure you don't get stuff in the future,
Yes.
then red light therapy could be a very smart thing for you.
Okay.
Now, before we go to the thing that we've been waiting for, I do want to remind you that I told you that if you go to a specific website, you'll learn everything I'm teaching you, and it's called Google Scholar. Have you ever been to Google Scholar?
Oh, I don't know if I have.
It's
Sounds familiar though.
scholar.google.com, or you go to Google
Okay.
and put in the word scholarly Google or something like that,
Okay.
and it looks just like Google. And you put in the phrase red light therapy. Now, you're going to get millions of entries. Some of them are just about red or the word light.
Oh,
So you can put quotes around it, red light therapy, and that would help.
yes.
But then you put in after that any word. So look up lupus, look up tooth decay,
Or
whatever.
dementia or yeah.
Well, yeah, all the things that I already told you that we help tremendously with. So we're
Right.
talking about arthritis, autoimmune disease, Crohn's disease, dementia, diabetes, dialysis. We've seen people who were minutes away from, I'm exaggerating, but
Yes.
very close to needing dialysis.
Right.
Now they don't.
Wow.
We talked
This
about
is
heart.
remarkable.
We talked about Lyme disease. Now, multiple sclerosis is like tooth decay in the sense that it's eating away, like a cavity sort
Oh, the myelin sheath.
of the nervous tissue. Yes.
Right.
So we can't reverse that. But what we have seen is that red light therapy can halt the progression.
Oh,
Never seen that
that
before.
makes sense.
It halts the progression. Then also neuropathies, all kinds of issues where people are having weird sensations down their leg.
Okay.
Great success with that. Well, any orthopedic.
How about cancer? Hey, I'm from New York
Hold on one second.
originally.
So also Parkinson's, we already talked about that. Rheumatoid arthritis, stroke. Had a lady
Oh,
that had
stroke. Wow.
stroke, for example, and she was better after 8 visits. She was better than she ever was before the stroke. Okay, cancer. I should have told you in the beginning. Let's stay away from the word cancer because
Oh,
cancer
okay.
is a huge institution and
Yes,
it's
it
a
is.
quadrillion-dollar business. And if
Yeah,
they think we're taking a penny out of their pockets,
I
they
gotcha. Okay,
can
so
come
we'll
in.
just eliminate that question from the video.
You could keep it in there so that people understand why we're not talking about cancer.
Okay.
So now let's
Too
talk.
much money is being made on treating it.
Correct.
Okay.
And there's too much money and all kinds of stuff. What people don't realize, again, how expensive it is to be sick. Can you imagine? There is a drug out there that starts with an R, and I'm not going to go over the name of it because I probably
Yeah.
get in trouble.
Yep.
And it's for ulcerative colitis. And it's an
Hmm.
IV drip. So it's a biological, right, which is a real
Okay.
great mechanism they have here because you can't just do it yourself. So you have to go to a center and they give you an IV and it's a 1 hour drip.
Oof.
Take a guess how much they bill the insurance for that.
For one treatment,
One treatment. It's an hour dose.
$10,000.
You're almost right. If you
Oh,
multiplied that by 5.5 times,
one treatment
55,
is over $55,000?
it is
That's what they're
55.
billing insurance?
That's
Oh
what they're
my
doing.
gosh.
And they get about 40 for it.
Wow.
So do you understand? It's very difficult to compete in this
I totally
industry
get that.
when they
Yep.
can make so much money and natural healing doesn't make a fraction of that.
Right, right, right. Exactly.
All right, so let's go on to the mechanisms. First of
Okay.
all, let's talk about the word infrared.
Oh, okay.
Now, so there's red, which burns bright red, and then there's this thing infrared. There's no such thing as just infrared. It's
Hmm.
either far infrared or near infrared.
Oh, right.
So now far infrared is about heat. And near infrared is what I told you before. We kind of called it cold or not heat. And again, with our device, avoiding heat is critical. So far infrared would be the last thing we'd want to combine when the light is actually happening. Now, afterwards, you could do far infrared, you can do all that stuff. But while you're in the bed, while you're getting red light therapy, you don't want heat anywhere in the neighborhood.
Okay.
Now, the word infrared then is really, when we're talking about, we don't touch far infrared, we only do near infrared. So now let's talk about the term red light therapy. When I say the word red light therapy, I'm talking about the combination of integrating red and near infrared.
Oh,
We were the
okay.
first company 12, 13 years ago to integrate red and near infrared.
So
Out
say that
there,
there was either near or far. So what is red then?
red is red.
So
So there's
red
infrared,
light.
there's infrared,
Okay.
but then there's the whole rainbow,
Okay.
green and purple and orange and blah, blah.
Sure.
That's the rainbow, right?
Yes.
And in the rainbow, it has been shown that red is glorious for fat loss, and no other lights help the fat loss. Only red,
Just the red light.
only red.
Oh,
So
interesting.
that's why I
Okay.
said before, I never used red up until 14
Right,
years
right. You were
ago.
using near infrared the whole
Only
time.
near infrared because we know how much more healing it is. Now, red has some
Okay.
healing qualities, but not nearly as much as
Wow.
near infrared. So we talked about near infrared, which is invisible to the naked eye. So when we have lights on our bed, the red ones obviously burn bright red, and the others look like they're not coming on, but it's just that your eyes cannot perceive
Oh.
that near infrared energy.
Huh.
All right, so now let's get back to fat loss. So what they learned 14 years ago, they had no idea why it worked, but they saw that it did work. And they assumed that it was melting the fat that made the fat easier to come out of the body. That's not what happens. So what they finally learned was that the red affects the fat cells by making the fat cell wall become more porous temporarily.
Oh.
It only lasts for less than a day. So you're not destroying the fat cells. You're not doing anything like
Ah.
that. But the fat cell contents can leak out, some of it, to the surrounding tissue. And then with our unique protocol, including whole body vibration, we move that fat away from the fat cells, eventually through the
Ah.
lymphatic system to the liver for use or elimination.
And that whole body vibration is a separate unit. It's not in part of the bed. Is that right?
But you would never want it part of the bed because the
Right.
bed should just be lights, no
Right.
vibration,
Right.
no heat, nothing.
And I've seen those vibration units that you can stand on. Is that the same type of thing? Is
The
that
only
considered
thing
a
you
whole
want is
body?
a standing whole body vibrational unit.
Okay. Okay.
And that's what we include with the purchase of our bed.
I see. So anybody that does a treatment does that whole body vibration after they get off the bed.
Correct. It's a 10-minute
And
dose.
that's regardless of whether it's weight loss that they're after or anything. It's just, does that help
Yeah, it helps everything.
make
But
everything more effective?
yeah, but it's mostly for fat loss,
Okay.
but also
It has other benefits.
I had whole body vibration in my practice before red light
Oh.
and weight loss and all that stuff. We just had it because we knew that it helped the body.
Mm-hmm.
And so I was a spokesperson for one of these whole body vibrational units. They're not in presence any longer.
Okay.
So
Okay.
the red light will change the permeability of the fat cell wall, making the fat
For
cell
about a day.
more for about a day, making the fat cell wall more porous, allowing the fat contents to leak out. And then with our unique protocol, including whole body vibration, we move that fat away from there. And it works.
Okay. Cool.
But it does have to be combined with a smart diet. Not an outrageously restrictive diet, but a smart diet, something that somebody will follow for the rest of their lives. The word diet is a scary thing because a diet means there's a beginning and an end to it. And the day that that diet ends is the day that person starts putting all that weight back on.
So it's more of an eating plan as opposed to a diet.
Right? A lifestyle. Yes.
Lifestyle, right?
All right. So that's the easy stuff. Let's move that aside. That's the fat loss. That was only discovered about a little of a decade, 12 or 13 years ago. I'm a healer.
Yes.
And even though we know fat loss will bring more people into the practice than probably anything else, we also know that healing is, for me, is the miracles. And So now how does that darn thing work? So 50
Yeah.
years ago, they just started doing research on it, but it took them a while to figure out how it worked. And so there are some key words that are involved, but essentially it's about sunlight. It's about taking elements of sunlight, magnifying them many times and driving them into the person's body. Not UV light, not other things that might be a little challenging for the person's body, just red and near infrared. And we have 4 elements of those.
Huh.
And when that first was discovered, they didn't know exactly how it worked, and now they do. What they learned is, why does somebody going out in the sun in the old days, hundreds of years ago, they told people, go sit out in the sun for your tuberculosis, for your whatever. And it would help to a degree, not to the degree of what we have now.
It's not as concentrated the way it is in this
Right.
red light therapy.
Yeah, if you're having a heart attack once a week, I wouldn't just say sit out in the sun. I'd say get in a bed. But anyway,
Yes.
so what they learned was that sun, as well as our lights, stimulate a very critical tissue of the body. So the body is made up of tissue, and every tissue is made up of cells. And every cell has mitochondria, right? And the mitochondria is the powerhouse of the body. It's the reason why you breathe oxygen and eat food, to make this incredibly important molecule called ATP. And the ATP is the energy currency of the body. If you don't have enough ATP, you will not function properly. If you have enough ATP, then you could function perfectly, so that you could ward off most diseases coming your way. Why didn't everybody succumb to, for example, the COVID? Well, it's because the healthier people didn't succumb to it. But most people who passed away already had what they call comorbidity, had other issues that weakened their system, so that the COVID came in and took advantage of that situation. That's what viruses and bacteria do. They find weaknesses and they take advantage of you that way. So you want to be as strong as you possibly can, having the strongest immune system you possibly can. And sun, or in this case, our lights, can get that. What does it do? It stimulates the mitochondria to come back to life. But how does it do that? So there are tissues in your body that are called chromophores. They are receptive to sunlight.
Okay.
And guess what? The mitochondria is not a chromophore. So the mitochondria by itself is not stimulated by sunlight. There's an element that they finally found out that's in the mitochondria called cytochrome C oxidase. It's an enzyme that is a chromophore, that is stimulated by light, our lights in particular, and that's what stimulates the mitochondria to come back to life. And now you'll see better production of the ATP that your body needs for every function in your body, including healing.
Huh. So that enzyme is produced by the body naturally, but it's
The enzyme is
enhanced.
the making of the enzyme is in the walls of the mitochondria.
Okay, but it's enhanced with the red light therapy.
Correct.
And vitamin D3 doesn't play a role at all in any of this?
It's not involved with this at all.
Okay.
Do I mind somebody having the right amount of vitamins in their body? Of course, that makes sense, but that's not what we're talking about here.
Right.
So when someone says, "What are you talking about? It can affect every tissue in the body?" Yeah, because every tissue in your body has mitochondria.
Right.
In fact, when I went to school a long time ago, we learned that there was one mitochondria in every cell of your body. And that's not true. The heart, which has the highest demand for energy, has over 5,000 mitochondria in each of the heart cells.
Oh my word.
Now I'm going to tell you something that you're not going to believe.
Okay.
Ready?
Yes.
The mitochondria, they have now learned, is so prevalent and so important in your body that the mitochondria makes up 10% of your body weight.
What?
Look it up.
That's amazing. And do we lose any mitochondria as we age?
Not really. What happens is the mitochondria becomes less active.
Less active. So it sort of partly
And
goes to sleep. Kind of like stem cells? Is that similar to stem cells?
there is a similarity, but we're not going to go there with stem cells right now.
Right.
What I want to tell you is that when I say there's a similarity, it doesn't mean that you're doomed. What it means is that we need to bring the mitochondria back to life.
Right. Just wake them up.
And the way to do that is to use sunlight to some degree,
Okay.
and use red light therapy to a larger degree.
Right.
When we find a location closest to you,
Yes.
I'm going to suggest that you go there. And when you call, tell them that you heard me on this podcast and that you want a special rate for these 6 visits, and then
Oh,
have these 6 visits done.
okay.
Then after that, I would love for you to email me what you noticed. And I don't care what you got, get in the bed. In fact,
Yeah.
this was one of my staff members made this up for me. Can you read it?
Get in the bed. And of course, that doesn't mean just the sleeping bed. It's the
Right.
red light therapy bed.
Yeah. And that's my feeling. It's like knowing that there's no side effects, knowing
Right.
that you couldn't be hurt no matter what. Why not try it?
So, what's a typical visit cost?
So typical visit, listen, I had 12 practices. One of them was in Beverly Hills. We charged more in Beverly Hills than
Sure.
we did in other locations. So
Yep.
location's one of the things.
Sure.
And the other thing is the degree of the person providing the service.
Ah.
They might charge more. So we've seen it as low as $75 a visit. We had a guy that was charging $500 a visit.
Oh my word.
And I didn't argue with him. I thought that was a lot, but I didn't
Yeah.
argue with him because if you get it, you get it. But
Right. If people
that's
are willing to
pretty
pay it.
unusual. It's
Yikes.
usually somewhere between 75 and 150. So when you go to
Oh,
the website on the Contact Us page, on the left side is how to find a location closest to you to try it. On the
okay.
right side is how you can find out if it makes sense to purchase this thing. We
Yes.
have a home model, which is less expensive, but we have the business model, which is what most of our sales are with the business model.
Right. So you can get a home one and it's just as effective as the business model?
It works
It
very well.
works. Okay.
I wouldn't say it's quite as effective as the high-end business model,
Right.
but we've had very nice results, great results with people using the home model.
Okay.
The business model has some features that make it stand out. But again,
Mm.
both models come with a lot of different things. We include the training, the coaching. If it's a business model, we include the marketing, we include the print material.
Oh, wow.
Like I said, 32 things that are included with the purchase.
Wow. That's incredible. Huh. Well, I've got to find out if there's anyone in Vermont that has one.
That's a good question. So go to the Contact Us page
Yep.
and let's see if we can find a location closest to you. Now,
Okay.
the other thing is if we don't have an office near you, then it is all of a sudden become your obligation to get one near you.
Yes, absolutely. No, this is fascinating. So I'm going to just ask you one last question, which is there something that I didn't ask you that I should have?
I don't think so. Oh, you
Okay.
know what? How about contraindication?
Oh, yeah. Thank you.
Who should not use the bed?
Good question.
And,
Nobody?
and there's really no contraindications. However,
Okay.
there are some legal
Oh, I see.
contraindications.
Pregnancy?
So one of them is pregnancy. Yes, thank you. Now, it would be helpful for the mother and fetus, but if that baby comes out anything other than perfect, they're going to want to blame somebody for that.
Of course.
And so I just tell people, let's not be in that neighborhood. And then right after the delivery, we would suggest get the mother in that bed ASAP, especially if it's a C-section. People will recover from their surgeries so much faster. So if you've had surgery, getting back to contraindications, you can get in there with metal stitches,
Oh,
the
so
metal wiring. You can get in there with an implant, a
yep.
pacemaker, any electronics. You can get in there with a shoulder replacement, hip, knee replacement. So the metal is not contraindicated.
That's amazing. So basically just pregnancy. Can you put an infant in it?
Yes, but it's the same question. Can you put a cat in it?
Oh.
Will the
Oh,
cat or
that's right.
infant
Pets.
stay still? So what mothers do, what I have heard, is that they get in the bed and they
Ah,
have
and
the
the
baby
baby
on
falls
their
asleep
on
on
their
them.
stomach.
Interesting. Have you done any pets? Have pets gone through this process?
Oh, absolutely. Not so
Interesting.
much my company, but before humans got involved with red light therapy, veterinarians got involved. Not that veterinarians are not human, but their patients are not human.
Gotcha.
And they were using red light therapy on horses and large dogs
Oh, wow.
before we got FDA clearance. So they didn't need that. They would attach a pad to a horse's leg and it would heal faster.
Oh, neat.
So if your question is, can animals Can
benefit.
they have success with red light therapy? And the answer is absolutely.
You
And
have
that
to be
can,
still, though, did you say?
yeah, I think dancing in the bed would be challenging.
But I mean, in other words, if you had a dog that was walking around in there, that would not be as
They
ideal if,
can't walk around, but
oh, they can't. It's not enough space.
because their claws could scratch the
Oh,
acrylic. I
not I.
suggest it's not the ideal scenario.
Okay. I love all the new technologies that are coming out for healing. I just
Absolutely.
think it's
And again, I'm
exciting.
not saying bed only. I'm saying
Right.
when you bring it into your practice, your business, it will become a centerpiece, no question about it.
Yeah,
It's a magnet that people will want to get into the bed.
sure.
That doesn't mean if you're an acupuncturist, stop doing
Right,
acupuncture,
exactly.
but it
Gotcha.
becomes very popular, very popular.
Wow. Cool. Well, all right. I got to get to work and make sure that if there's not one in Vermont, somebody's got to get one
Yeah, that's your
near
job.
me. Thank you, Dr. Carl. This was fascinating.
I appreciate having the opportunity.
If you enjoyed this episode, imagine how much better you'd feel if you started applying some of these tools to your everyday routines. I've created a free mini course just for you. It's called 5 Steps to Ditch Everyday Toxins Without Over. You'll learn simple, doable tips to clean up your kitchen, your food, and your everyday life without going broke or getting stressed out. This is the foundational shift that many people never make, and it's often why their health goals stall out. Get it now at greenlivingnow.com, and let's take the first steps together. I'm Amy Tedisco-Hartshorn, and I'll see you on the next Green Living Now podcast, where real wellness starts with what you bring into your life as well as what you let go.